Hello everyone, this is RN Sakshi Sharma. Welcome back to my channel. In my last video, we have discussed about the content areas of NCLEX-RN exam, in which we have discussed the first main factor, which is safe and effective care environment, which comprises of two sub-factors. First is management of care, second is safety and infection control. So management of care we have discussed in my last video, which comprises of 17 to 23% of chunk. And in today's video, I'm going to discuss about the safety and infection control, which comprises of 10 to 16% of your test. So let's get started. In safety and infection control, what does that mean? That means we have to protect clients and healthcare personnel from health and environmental hazards, which can, delay the comprehensive healthcare provided by the staff members to the patient. So there are some key points which need to be considered under the safety and infection control. So first is incident reports or safe use of equipment. Incident reports are designed to use by healthcare personnel if any circumstance happen in your health department with visitors, with patients, with healthcare staff. Then we use this incident reports so that in future it cannot be happen again, or what steps were taken to improve that situation. The other thing is safe use of equipment. Safe use of equipment is a key point, as we have to make sure that everything is working without any electrical error or which can delay the care to the patient. Next is substance abuse, staffing, improper care. Substance abuse is also more common in hospital settings. So this is the NCLEX-RN alert point which should be considered. So in safe use equipment, I already mentioned like frayed electrical cords, missing parts. If these equipments are not working or they're malfunctioned, we cannot provide the direct frequent care or adequate care to the patients. So that's why nurses should be acknowledged with all this stuff, that what should we do if such situations occur. The other thing that I have, the most favorite point or the topic for the NCLEX-RN, we can expect at least one question in our exam, which is transmission-based precautions, which covers off standard airborne droplet contact precautions. These things should be in consideration with nurses, because these can be used to maintain the aseptic techniques and to prevent infection among patients and the healthcare staff as well as visitors. The other point I have here is proper use of restraints. This is also an important topic for NCLEX-RN. Why this is an important topic? Because restraints are designed for patients, like sometimes they are mentally ill, they don't take their medicines, they don't acknowledge with the protocol which we are following there. So for example, patient is on ventilator and he just wake up immediately and he's just running here and there. So he's just pulling out his pipes, ET tube and all stuff. So that's why he's pulling maybe he's also pulling his oxygen saturation probe. So that's why, to amend with that thing, so nurses should be properly knowledgeable with this point, that what should we do when the patient is on restraint, because restraint can be only ordered by doctors. So what nurses should do so that patient can get that physical and emotional, spiritual, all those ailments covered. So we should check frequently on patient, that is patient doing fine, is there any skin breakdown, have patient calculating the intake and output for the patient, like all the needs should be met. So that's why NCLEX-RN focuses on this point, that what nurse do if the patient is on restraints, how to tie up the restraints. There are some protocols for that as well. So that's why monitoring clients frequently in this is the basic criteria. Other is handling hazardous and infectious material. So in infectious and hazardous material, I mean chemotherapy, radiation. There are some radiation implants. So chemo is a hazardous material. So what precautions should we take if there is a spillage of chemotherapy on the floor? What should nurse do in that situations? Because this is a hazardous issue if we see, because we have to double glove ourselves, we have to use proper PPE. So that's why NCLEX also loves these kinds of topics. Other I have is home safety. Then is ergonomic principles. Ergonomic principles covers off how the patient can use crutches, canes, walkers, wheelchairs. What things or what factors should the nurse consider if the patient is using this stuff in their home or in the hospital setting, so that they cannot fall, that it can lead to the injury prevention as well if the nurses are for sure acknowledged with this content areas. So NCLEX love these kind of questions as well in their exam. Next we have is accident, error, injury. So we know we should be alert that allergies, right? Some people are allergic with penicillin, so that if they are having any bacterial infection, so regardless of penicillin, we can prescribe them other antibiotics. So these are some basic knowledge which the nurse should be, acknowledged. So emergency response plan, which comprises of triage. Triage means, so who should be first treated if a disaster or if an earthquake comes. So what should the nurse do? So the nurse will provide care to those patients who can be saved. So some patients come, dead, which are categorized under the black category. So we don't treat them. So there are many subcategories under the triage program, so that the nurse can react immediately to whom we have to, treat first according to their client needs and their diagnosis. So these are some key factors which can be considered in your NCLEX-RN exam. So emergency response plan, which consists of triage, also plays a key vital role in your exam. So these were some stuff. They seems to be basic, but we have to practice more and more questions related to them. This is just a brief, ideology. It will become more clear. It will clear your horizons once we will start discussing these topics in, brief theory, so that you can have a clear concept in your mind that what option should be picked up on your knowledge and content. So now I would like to practice 2 sample items on this topic. So first question I have is, a nurse in a long-term care unit found out that insulin pump is not working. So we can directly recognize that it is on safety principle. So based on safety principle, what should RN anticipate? Anticipate means think that what to do next. So we can read the question again. A nurse in a long-term care unit found out that insulin pump is not working. Based on safety principles, what should RN anticipate? It is a very clear and straightforward question. So options we have is ignore the situation, B, inform the nursing supervisor, C, unplug the pump, label the pump as out of order and replace it with functioning pump, or D, tell the incoming nurses to rectify the situation. Sometimes students get confused and they will say, okay, we can inform the nursing supervisor in this situation, but that's not correct. So let's look ahead. So first is ignore the situation. As in my prior video, I have already told you, nurse cannot ignore the situation. There is always something to do for a nurse. So this option seems to be wrong. The option we have is inform the nursing supervisor. We can inform the nursing supervisor. Okay, we can keep that option in our mind. Next option we have unplug the pump, label the pump as out of order and replace it with functioning pump. Well, this seems to be correct because I have already discussed here frayed electrical cords, missing parts, safe use of equipment. So in future, if we want to use the insulin pump, if it's out of order, how we can use the pump, right? So that can be an issue. So that seems to be a correct option, but I will also read the last option. Maybe that can be answered too. So always read all the options which is given in your exam. Last is tell the incoming nurse to rectify the situation. So how it's possible? Like if you are doing a morning job, it happened in your shift and you're telling the other nurse, hey, can you do this stuff for me? No, that's absolutely unethical. So what we will be doing is unplug the pump, label the pump is out of order and replace it with functioning pump. And after that, we can inform the nursing supervisor. So first we are gonna do this, right? So like you have removed the safety issue from the patient room and you are replacing it with the functioning pump. So the delay, like there will be no delay in the patient's care. So that is the option with the correct description or the content. Next we have is question 2, which I have based on home safety. 82-year-old patient with hip replacement is discharged from hospital. Nurse was providing health education to client about home safety. Which client statement requires further intervention? So from here, guys, you have to clear your mind. Further intervention means that something is wrong and we have to correct it. Intervention means to act. So that means there is something wrong with the situation that patient is doing. So we have to further guide him where he is wrong. So further intervention means there is something wrong. We have to be alert what's wrong. A option is I can use rugs. B, fire alarms should be functioning. C, adequate use of lighting in the home. D, I should use raised toilet seats. So guys, this can sometimes confuse you in the exam if you're not clear. So 82-year-old patient with hip replacement is discharged from a hospital. Nurse was providing health education to the client about the home safety, that there is something which should be concerned if you are at home. Which client statement requires further intervention? Let's get started for here. So I can use rugs. So if we will discuss the musculoskeletal system in further videos, so you should be clear, rugs are the main reason for a patient to get fall. So this is a safety thing. The other option we have, fire alarms should be functioning. This is a good thing, fire alarm should be functioning so that we can recognize if there is a fire or something. So this option seems to be correct, that yes, patient is saying right, that fire alarm should be functioning. C options, adequate use of lighting in the home. That's correct as well. So patient is right here that there should be proper lighting in our house to prevent falls. Last is I should use raised toilet seats. So guys, this is also correct, as the hip replacement, knee replacement people, they should use the raised toilet seats so that it cannot put the pressure on your hip. So this seems to be correct as well. So what's wrong in this option is I can use rugs. We have to correct the patient that no, you cannot use the rugs as it can lead to fall. So we have to guide them. You cannot use rugs. You have to unclutter your home. There should be proper space to walk off. So that's why this is the correct option. But sometimes students get confused when it asks requires further intervention. That means something is wrong. Patient understands the teaching, but something is not still, completely understood by the patient. We have to guide him correct. So these are some key points, or that's why I say this content should be cleared, which will be discussed in your further syllabus, but I'm just trying to tell that what the content covers in each and every section, how your NCLEX-RN exam is based. So guys, try to practice as many as questions if you are already preparing from any coaching institute, any sources, or maybe Saunders. So just try to practice as many as questions which you can practice, rather than just reading theoretically, or just focusing on you can say if you're just focusing on the superficial things, right? If you're just reading the content, if you're just reading in paras. But the best strategy to pass your NCLEX-RN exam is practice as many questions as you can, like this. It can clear your concepts and your horizons as well, and you will be more confident to give your NCLEX-RN in first attempt. So I wish you a good luck, and I hope you like this video. Please share with your nursing peers, and thank you for watching this video.